Welcome back. Brain health. It is a big concern for many families with Alzheimer's, Parkinson's, strokes, aneurysms, and ALS all on the rise. Here to help us learn more is Dr. Nina Moore from the Cleveland Clinic. Thank you for being here today.
Oh, thank you for having me.
When we hear, I read the statistic, nearly 6 million people have an unruptured brain aneurysm each year. Before we delve into that statistic, what is an aneurysm technically?
So an aneurysm is a weakening of the blood vessel. And so normally blood vessels look just like a normal tube. Sometimes they branch like a tree branch. But in certain areas, especially at the branching points, you can get a weakened spot where the blood pressure is pushing blood against it, and over time it kind of bubbles up to form a weakened spot of the blood vessel wall.
So that would become then an unruptured aneurysm?
Yes.
And so do you know if 6 million people do you know that you have an unruptured aneurysm?
Usually not. A lot of times they're found incidentally while people are getting other sort of imaging done. If someone has a family history of aneurysms or starts having severe headaches or has like a sudden onset of a new nerve injury, compression, sometimes you can have a symptom beforehand.
Are you only feeling any symptoms in your head area?
Not always. Sometimes people start having neck pain. In patients that have, they can have vascular malformations too that can present with like sudden onset of back pain too.
So do they, if they're an unruptured aneurysm, do they stay there? Do they dissipate? Can they go away?
It's pretty uncommon for an aneurysm to go away. Sometimes they can clot off and I guess heal over. In cases where you have a flow-related aneurysm, where you have a high-flow vascular lesion, sometimes they can involute if you treat the actual vascular malformation. But overall, they tend to just kind of linger there.
So what can we, because again, so many of us could be walking around with one of these and we just have no idea. So I think this is such an important topic for us to discuss. Is there a way for us to prevent even an unruptured aneurysm from occurring?
Yes. So one of the biggest things is not to smoke. So smoking can cause blood vessels to behave a lot more, they can form more likely areas of having enlargement of a weakened spot.
Okay.
I would also say if there's a family history of aneurysms, like if you have an immediate family member or two immediate family members with an aneurysm, someone should get screened early. Additionally, if you have high blood pressure or have a known other blood vessel problem like Marfan syndrome or Ehlers-Danlos or some sort of like known vascular condition, you should be getting screened, or polycystic kidney disease, things like that. People should be getting screened.
Now, I know that they can be deadly, but if you do have one that ruptures, you can also still live after that, right? What are typical complications after the fact of one? Are there, or can you go back to leading a normal life?
Well, so about a third of people don't make it to the hospital when they've had a ruptured brain aneurysm. A third do, but they end up with maybe some neurologic injury. So the injury can happen either in the initial rupture phase where there's blood that's pushing on normal brain tissue and damaging it. There can also be in the immediate aftermath of an aneurysm rupturing. Your blood vessels can spasm, much like having a stroke. And so those things that we take care of in the hospital to try to prevent that from actually becoming a permanent problem are very critical in the initial phases right after an aneurysm rupture.
So for those hypochondriacs out there like me, I'm listening to you talk about this and I think, okay, is there any kind of scan that I can just get done to make sure that I don't, would you recommend that to anyone, even if they don't have a history? And what kind of scan would you get?
So I usually recommend it if there's a family history.
That's okay.
And it would be an MRA brain, and it doesn't have to be with contrast. And so it's like a study that lets us look at the blood vessels without like contrast or radiation. So it's a nice screening exam for us to look at people's blood vessels.
And that mostly would be then for people who just have a history of it.
Yeah.
Okay. So, all right, I'll just have to live with this one. No, but hey, I think the educational aspect of this is so wonderful in learning about it. You're having a walk coming up with the Cleveland Clinic here.
Yes, 10th annual cerebral aneurysm walk and run. It's going to be at the Emerald Necklace this year, which is a change in location. Our wonderful nurse practitioner, Tina Rezer, has been putting this together for the last 10 years. And it's just an excellent experience for us to not only share information about aneurysms, but also see former patients, see their families. It's a wonderful experience, and it's like our whole department comes out and sponsors this.
Now, to make myself feel a little better really fast, if we're doing things like working out, eating healthy, although like those things can contribute to just hopefully warding off things like that.
Yes, and good blood vessel health. I think just being healthy in general and avoiding some of those, like making sure if you do have blood pressure, pressure issues, getting that addressed, and getting annual screening with your medical provider. Those can all help kind of prevent some of the long-term risks for these things.
Okay. Well, thank you so much for